All right, we're here with Ian, who is a firefighter out at Burlington and many other places, right, around here. So anyway, you've had a lot of back issues, right?
Yeah.
Back problems. And what we're doing, everybody has, the same muscles, but they're all just used slightly different in how we use them in a day-to-day activity. Well, I asked Ian to take this ball and work on his hips. And after I did that, what did you feel?
Pain.
Pain. You didn't even realize, you said, and I quote, I didn't even realize there was a muscle there that could cause this amount of pain, feeling.
Yeah.
So what we're actually doing, as you can see, we're right on his glute max, the upper part of his butt, right? And we are trying to loosen that with this softer but larger diameter, probably a 3-4 inch diameter child's toy bouncy ball thingy. Anyway, so we're working across that muscle that affects hip and femur. So are you very flexible touching your toes?
Yeah. See?
Try it with that side.
This side?
Try not to round your back and just try both. Now see if your left feels any different than your right when you go straight down. What do you feel?
I feel like my right side's tighter.
Your right side's tighter. That would be this side that we did not use, and you did 3 minutes of that on the wall, right?
Yep.
Now let's do your other side. Now here's the thing, what we're talking about is everybody has the same muscles, right? It's just how we use them. So I was working on this last time with Derek, his power lifter that squats and deadlifts insane amount of weight. Ian does not do an insane amount of weight, but what do you carry? How much does the suit weigh?
Approximately 75 pounds.
So around 75 pounds in a unpredictable, possibly, environment, right? We were just talking about, smoke and all sorts of stuff that he's not even seeing, but he's carrying 75 pounds, bumping boots on things that he can't see, possibly. So what happens is he might get smaller strains when the power lifter, we're in the gym and we know exactly where the weight is. We're not doing it blindfolded, all this stuff. So what happens is Ian actually might strain his muscles possibly more than some of the people that are just lifting heavy weights because it's his adrenaline's high, hormones that are keeping him able to fight, able to adapt in that situation of a life-saving situation. I'm talking so loud because we're on the video. I normally don't shout at people, but that's awesome. But anyway, so Ian may, under high levels of adrenaline, not notice that he has strained hip musculature or ankle or anything, really, because he's just trying to get out of that situation. Once the situation's under control, get some rest and notices, wow, I am so tight, right? So it's very important for us to take care of not just certain muscles, but all of our muscles. If Ian wants to maintain, and any firefighter wants to maintain high level, capabilities without getting. There's a lot of injuries in the field from overuse, from under recuperation. But anyway, simple fix work. I can't say fix, I guess, but simple care of the glute medius, glute maximus, TFL, the internal rotator of the hip on the outside. Anyway, it's just with a simple ball. And I mean, if you had some of the guys doing this at the station, at the firehouse, using certain techniques like this, what do you notice most out of this?
My mobility is increasing.
Awesome. Mobility is increasing. So if the glutes are really, really tight, you're not going to be able to flex forward at the hip. You're not going to be able to pull your knee as high up, and then it's going to go right into your low back. You're going to start, instead of hinging at your hip, you're going to start hinging at the vertebrae, and then under a heavy load, you're not going to have the powerful glutes to help you with stability and strength. So picking up things, walking, especially climbing stairs, stepping over obstacles, and climbing up ladders. It's a glute. How do you feel?
A lot better.
A lot better, and it's a 5 to 8 minute thing. Now see that? What my analogy for Ian was, if you have tension, you have knots in the muscle. It's the same thing as having a fire hose that you are not reeling in properly. You're just throwing it in the truck, you're just throwing it on the ground, it develops a knot. It's 50 foot long, and all of a sudden you have to stretch it out to 50 foot. It's got 3 knots in it. Will it be 50 foot? No, it'll be shorter. So if you keep stretching it, what's going to happen to the knots? They're going to get tighter, possible strain, a lot more strain at the points of the knots, and that hose is going to get worn out. So with this technique of loosening up the tight tissues, why people should get massages, find a good massage therapist to work with you, especially if you're in a job that's a very physically demanding job. You definitely want to do this. Take care of your tissue. Your tissue is what's moving your muscles, what's moving your bones around. It's what's helping you do things, whether it's 200 pounds, 500 pounds, or 5 pounds, or lifting your leg over an obstacle with 75 pounds of weight distributed on your body. So anyway, good thing to do. Tiny, and we only have affected 2 or 3 muscles right there, so there's a lot more to do. But overall, how's your knee feel when you lift it straight up?
Almost no strain.
How's your back feel?
No strain.
You've had some back issues before, right?
Yeah, I've been in 3 vehicle accidents in the past year.
One small point. Hips are important. Check you later.